Sample questions for Prometric Exam. Nursing Care Skills Test Part 3. SSW, Japan. What is true related to rest and sleep? Tama! The correct answer is letter A. Sleep is essential for the mind and body, and for the cognitive and emotional well-being, or in maintaining the good health. Letter B. The depth of sleep is more important than the length. Letter C. Non-REM sleep is deep sleep, where the brain is sleeping. Letter D. REM sleep is close of being awake where the brain is not sleeping. Which of the following is the resulting disorder from brain damage on the portion of the brain that is responsible for language? Tama! The correct answer is letter A. Aphasia disorder results from the brain damage on that portion of the brain, which is responsible for language. Apraxia can happen due to a head injury or disease that affects the brain. Dysphagia is difficulty in swallowing. Dysarthria is a condition in which the muscle used in speech are weak, or a condition where one has difficulty controlling those muscles. Which of the following is correct in anatomical body positions? Tama! The correct answer is letter D. Letter A, face and upper body facing down, known as prone position. Letter B, face and upper body should be facing up, lying on the back, known as supine position. Letter C, body is on the left lateral recumbent position, where the individual is lying on their left side. Blank is the stage in the basic flow of care process where the information about the user are combined and gathered. Tama! The correct answer is letter B. Assessment is where we gather and combine all the information of the user and analyze the issue of their daily living. In measuring the user's body temperature, which of the following is not correct? Tama! The correct answer is letter D. Take the body temperature from the unaffected side for users with hemiplegia. Which of the following is correct about pulse rate? Tama! The correct answer is letter C. The normal resting heart rate or pulse rate in most of the adults should be between 60 and 100 beats per minute. What is the correct flow or cycle of the user's care process? Tama! The correct answer is letter A. Assessment, care plan development, implementation, evaluation. Which of the following is not correct in preventing pressure ulcer? Tama! The correct answer is letter C. Discourage prolonged bed rest to prevent pressure ulcer. Letter A. Change the user's body position at least every 2 hours. Letter B. The user should eat a well-balanced diet and take more fluid. Letter D. Make sure that the bed sheets are not wrinkled, which can cause discomfort while the user is lying on bed. Moisturize the skin after washing. For the protection of users' information or his, her conditions, confidentiality, which of the following is correct? Tama! The correct answer is letter B. Sharing records with the care team members for the user's progress and to provide quality nursing care is allowed. Do not share or disclose users' information to anyone without the user's permission. It is strictly required as part of the Professional Code of Ethics. The following are effects of disuse syndrome, except Tama! The correct answer is letter C. In disuse syndrome, there's a reduction of mental function. Disuse syndrome occurs when the people would not move for a long time, are in the state of inactivity, or are bedridden. It can lead to the deterioration of the body function, muscle atrophy, and chronic pain. The following are different types of abuse, except Tama! The correct answer is letter B. Tying the user's body, hands and feet is a physical restraint. Letter A is physical abuse. Letter C is economic abuse. Letter D, psychological abuse. The following are safety and preventive measures to be applied when disaster or emergency strikes. Which one is the exception? Tama! The correct answer is letter C. More than your material possessions, your life matters. What is the best way to prevent the spread of infection? Tama! The correct answer is letter B. It is important to wash one's hand thoroughly. The best way to prevent infections is to block the pathogens from entering the body. The first line of defense is by following the good personal hygiene habits. Infections are caused by microscopic organisms known as pathogens like bacteria, viruses, fungi, and parasites. Which of the following shows the proper sequence of cleaning the face? Tama! The correct answer is letter C. Eyes, forehead, nose, cheeks, mouth, jaw. In the basic flow of care process, blank refers to the stage where care is provided to the user based on the care plan. Tama! The correct answer is letter D. Care plan implementation is the stage where care is provided to the user according to the care plan. At yan lang po para sa araw na ito. Stay tuned for the next video para marami pa tayong mapag-aralan. Minasama mite kurete domo arigatou gozaimashita. Kung may natutunan po kayo, please subscribe and like or comment below for any suggestion. Thanks for watching! Salamat po!